Hi, my name is Amanda Crystal, and I'm a nurse navigator at Connect Care 3.
And I'm Michelle Gilmore. I'm a patient advocate.
Today we're going to talk about how to become an advocate for your own health. The healthcare system has evolved into a highly complex and often overwhelming network of hospitals, insurance carriers, providers, and many other behind-the-scenes players. For many patients, learning to navigate these systems can often be frustrating, and they find themselves easy to get lost in the shuffle. Furthermore, the healthcare payment model has shifted from a fee-for-service method where doctors could bill for the number of patient appointments to a payment model that instead focuses on outcomes, where doctors will get reimbursed based on how well their patients are doing. In spite of this shift, many patients will still only spend between 13 to 16 minutes with their physician, and in this short amount of time, it can be easy to forget that one really important question you wanted to ask or really gain a thorough understanding of your treatment plan. A buzzword that has popped up recently in the healthcare industry is a term known as healthcare consumerism. The concept of healthcare consumerism is where patients are expected to shop around for lower cost care, including imaging studies and outpatient surgery centers. However, the tools and support needed to make well-informed decisions are significantly lagging, and patients are often left scrambling trying to make a decision with the limited information that they have available. Not to mention, lower cost facilities do not always equate to quality. A primary care doctor may order an MRI of the spine due to back pain. The patient does their due diligence and shops around and finds a lower quality outpatient MRI facility to do the test. Several weeks later, the patient goes to see a specialist, a spine surgeon, and at that appointment, the surgeon may say that another MRI needs to be done since the quality of the initial study was not good enough. Therefore, the patient will have double the cost since a repeat MRI is going to be needed. While the concept of healthcare consumerism makes sense, the complexity of the healthcare system coupled with the lack of transparency makes it extremely frustrating for patients to try and navigate those types of decisions. Nevertheless, I think you will find that a little preparation can go a long way when it comes to learning to communicate with your team of providers and being able to advocate for yourself. A lack of understanding in regards to your health can result in catastrophic outcomes, including misdiagnosis, incorrect treatment, and non-adherence to the prescribed treatment. Health literacy also plays a significant role in a patient's ability to navigate the healthcare system. But what exactly is health literacy? Health literacy is defined as the degree to which one has the capacity to obtain, process, and understand basic health information and services to make appropriate health choices. Health literacy can be applied to understanding your benefits package, which includes copays, deductibles, out-of-pocket costs, and insurance networks, as well as understanding your diagnosis, medication, and treatments. The best way to improve your health literacy is simply by asking questions. Speak with your HR representative at work during open enrollments if you are unsure of something regarding your benefits. Speak openly with your team of providers if you have questions or concerns when you are at an appointment to make sure that you really understand why you're being started on a new medication or that you thoroughly understand the follow-up plan that's being recommended. Preparing for physician appointments is a crucial step and helps to make you more invested in your overall health and also helps you to advocate for yourself when needed. Prior to your appointment, steps you should take to prepare include make a list of any new symptoms you are experiencing and include information like when they started, how long they last, and if you have noticed anything that has made the symptoms better or worse. Bring along any relevant records, including lab tests and imaging studies. Prepare an up-to-date list of all medications and supplements you are taking. Prepare a list of questions to bring along to the appointment and be sure to reference that list while you are meeting with the doctor. Preparing a list of questions will help you to prioritize the visit and ensure all of your concerns are addressed.
Our nurses truly tailor their services to whatever a patient needs. They'll provide questions for appointments so that they can ensure those appointments are productive for both the patient and the physician.
If possible, it's always helpful to bring a family member or friend along to a patient appointment to help ask questions or take notes during the visit. During the visit, reference the list of questions you prepared, and if the doctor says something you don't understand, ask them to clarify. As the appointment starts to wrap up, repeat the information you heard, including the next steps, back to the doctor to ensure you have the correct information. Ask about any follow-up appointments, referrals to other specialists, lab tests, or imaging studies. Find out who to contact if you have any questions or concerns after the appointment. After the appointment, follow treatment recommendations, or if you are interested in going for a second opinion, schedule a visit.
Getting a second opinion offers a fresh perspective from a physician who might be able to offer you more or different information than the first physician.
If you decide that you would like a second opinion, the best time to do so is before starting any type of treatment. Make any follow-up appointments needed, and don't hesitate to call the office with any questions or concerns that you may have.
I've been a patient and advocate with Connect Care 3 for 11 years, and I've witnessed countless instances where our nurses truly exhaust all resources to help our patients find progressive treatment options and identify physicians with specific expertise to help them. The patient advocates are typically the first point of contact when an individual calls Connect Care 3, and I really strive to develop a rapport with them, put them at ease. I know it's difficult for someone to talk about their personal health history, and it's rewarding at the end of a call to have a new patient say, "I'm so glad I called today. I already feel better knowing I have Connect Care 3 as part of my team."